This video is for nurses, OT technicians, physician assistants, path technicians, and pharmacists. There is a great global career opportunity for all of you. And this opportunity is of hair transplant technician. I, Dr. Divya Pandav, co-founder of the esteemed Indian Society of Hair Restoration, ISHR, am introducing Dr. Vivek, co-founder of the esteemed Hair Restoration Institution affiliated with the prestigious World Society of Hair Restoration. So let us discuss in details about the global career opportunities of the same.
Thank you, Dr. Divya. So all the nurses, OT technicians, path technicians, and pharmacists, be ready. You had no idea about it, most of you, and there was lying a great career opportunity. As you know, as the things change, we have to upgrade ourselves, learn new things which are in demand. Let me tell you about first about the hair transplant. This career opportunity is hair transplant technician, which you can become. As National Medical Council has already allowed licensed BSc nursing, OT technicians, pharmacists, and DMLT to learn hair transplant and assist plastic surgeons and dermatologists in hair transplant surgery. Hair transplant surgery, you need team. A plastic or a dermat cannot alone do the surgery. They need hair transplant technician, 4, 5 in number, and then they can deliver good results. Okay, surgery is pretty simple. It's under local anesthesia. It's not done in a major OT. It can be done in a minor operation theater. So let me tell you why this opportunity. The baldness is increasing like anything across the globe. Initially, it was 50-year-old getting bald, then 40, 30, in the 20s getting bald. So there's a huge demand of replacing, hair from back of the scalp to the front, from body to the front. It's called hair transplant surgery. So clinics are opening all across India, all across the world. More and more clinics are required. More and more trained doctors are required. Now these trained doctors, these trained clinics require hair transplant technicians. So this heat transfer technician course, of course, you have to have good amount of time you have to give for this course, but minimum is 15 days, 1 month, 3 months, 6 months, 1 year, and 2 year training programs. Headquarters is at Mumbai, but we have affiliate centers in major metro cities across India and semi-metro cities and few selected cities worldwide. So you need to give some good amount of time. First, you will be working on the dummies and all. Then, under supervision, you will be working on the real grafts. So, there are certain things which a technician can do, that is, implantation and taking out the grafts. Technicians cannot make the slits, technician cannot punch the grafts. Technician have to prepare the operation theater table, do the dressings, follow up with the patient. But this implantation part is allowed worldwide. This is called half a transplant technician. So, once you talk to our counselors, the below given number, they will detail you about the class dates, fees. The faculty includes plastic surgeons and dermatologists. Under their supervision and senior nurses and OT technicians, you are going to learn in detail each and everything about hair transplant. And of course, what you can do as a technician, the implantation part also you will learn. So, as a hair transplant technician, at 3 months, you will become up to one level, 6 months, 1 year. You can join as an internee, as a junior technician, as a learning technician to any clinic after the courses. But once you have an experience of 1 year, then the career opportunities in India, the salaries may range anywhere from 30,000 to 75,000. Okay, you can do freelance with other doctors. Okay, then internationally, it's very, very high. America is the highest paying for a transplant technicians. Okay, then after America, Canada, Europe, UK, okay, then Australia, Malaysia, Indonesia, Dubai, Middle East, South Africa, India. There's a huge opportunity.
All over the world.
There's a huge shortage. India and Turkey still have good number of technicians because they started early. They're doing a lot of work. But I have seen is there are not great technicians in Middle East, America. There are, but still a lot in demand because one technician can be part of one surgery. 25 days is going to work. He can be part of 25 surgeries. Now imagine thousands and thousands surgeries happening every day. And it's not that doctor alone can do the whole surgery, right? So he definitely needs a very trained team. And then doctor doesn't want to leave this team. They don't want to change these people. So it's very, very important. And there's a huge demand. And I told you from India, 30,000 to 1 lakh rupees, 75,000 rupees. Easily after 1 year, you can get in through. It's not guaranteed, but I'm just telling you what are the rates outside. It all depends on how competent you are. Simultaneously, if you also learn how to counsel the patients, you like in America, there is physician assistants. Simultaneously, if you learn how to follow up the patient, so doctors' work is reduced. Like dermatologists, plastic have medical cosmetologist. So now dermatology and plastics are having medical trachologist. And also there are another course which you can club in with this called scalp micropigmentation and eyebrow microblading. So we will discuss in detail about the legalities, how to get license in different countries, what are sort of how to get the visas in the different countries, and how to approach for a great jobs in the different countries.
So, doctor,
Yes.
can you tell me what are the qualifications required for this particular course and the licensing processes that are needed for this particular hair transplant technician course that you're talking about?
That's a good question, doctor. Basically, what is happening, unfortunately, in the world, unlicensed technicians and unfortunately unlicensed
Yes.
doctors are also doing that. So to remove that system thing, there is a need for this training.
Yes.
So basically, if you are a BSc nursing 3 years, is a great job opportunity. Even if you're 2 years, that's fine. Similarly, OT technician 3 years or 2 years training, degree holder or diploma holder from an Indian university registered with nursing council is a great idea, or at least you should have a university qualification as a nurse, OT technician, or a pathologist, or a pharmacist. Okay,
Yes.
so this is the legality in India required. Now similarly, if you want to go to Dubai, you need to be 3 years BSc nursing or 3 years OT technician. Then you apply first as a nursing or OT technician.
All right.
Then there is a separate license in Dubai for hair transplant technician. So first you get, there's a Ministry of Health MOH outside Dubai, Abu Dhabi. There the regulation is a little different. But in Dubai, first you register as a BSc nursing, or you may be already BSc nursing registered in Dubai, or a OT technician. You need 3 years. Okay, so 3 years degree from any Indian college or anywhere in the world. So once you are that, then you can apply for a hair transplant technician. So hair transplant technician, after you get registered with this. Okay, but if you're 2 year nurses or 2 year OT technician, Dubai not allowed. Okay,
Right.
similarly, different countries have different regulations. So but as you know, Indian BSc nurses, Indian BSc OT technicians is demand all over the world. Like Indian doctors are so famous worldwide. Okay, in every nook and corner of the earth, America, Europe, London, you see Indian doctors all over, right? Similarly, Indian nurse now, UK need nurses like anything, so they are getting entry to the nurses easily. But hair transplant is not covered under insurance, not under NHS of UK. Okay, so all the countries, hair transplant is a cosmetic procedure, so it is practiced as a private. So you very well know, if you go to Dubai as a nurse, you get an X salary, but if you know hair transplant, you get sure most probably double the salary. Anywhere in the world, whatever as a nurse you're making, chances are you're going to get double because there's no insurance cover. So this is the reality. If you're 3 years BSc degree or BSc OT technician, you're very welcome. If you're 2 years, in certain countries, in India it's okay, then certain countries allowed, in certain countries not allowed. So different countries have, Malaysia is there, Indonesia is there. So right now there's a huge demand of technicians in America, UK, Europe. Then you see there are a lot of technicians. See, if you go to the LinkedIn, if you go out there, there are so many nurses in Europe, England, America, worldwide. They're making great career, great money because they are 5, 7 years experience. They learned it much early. So at least in Europe and USA, Europe I have seen, especially Eastern Europe, there are some trained technicians available. But you see, most of these trained technicians are already working in top clinics. So the newer doctors definitely require them, and there is huge shortage. So this was a little light about the legality as such. And of course, you need some time to learn. It's not that you can learn overnight. Yes, you can have an entry overnight as an assistant technician. Then you go to middle level technician, and then you go to the senior level technician. It is, you have to wear a magnification loop, and it is hand-eye coordination under magnification. It's like you're wearing a loop, putting thread into the needle. So gradually, somebody who's a fine fingers, long fingers, girls are very much in demand because you need to have patience to become a hair transplant technician.
Okay.
You have to be listen to the music and slowly do. So if you have an artistic hand, if your eyesight is good, if you work with micro things, so they do testing. Are you going to be a good candidate? So we test you. Can you do micro work well? So we have seen people whose long fingers, great eyesight, patience, easy to go, not too anxious, they tend to become, because it's a 6, 7 hour surgery. It's like a diamond work, like how you have to work small, small, small. So patience, of course, left-handed technicians required, right-handed technicians required, okay, even afro hair technicians required, and not just hair transplant technicians. Scalp micropigmentation is in great demand. Eyebrow microblading is great demand, and luckily for scalp micropigmentation, eyebrow microblading, The licensing is very easy, okay, because that even if you have a 2 year, that's also fine, because once you get trained here, then most of the top countries have their own affiliated colleges. Once you do 3 4 months stint there, then if they're affiliated as a license, then in that country you get a license to become scalp micropigmentation or eyebrow microblending expert. Then you search for jobs. Then of course, if you have some doctor friends, then you can open the clinics also together.
Thank you, doctor. So, as you see, the doctor did elaborate on the salary perks if you do this particular course. Also, I would like to know, doctor, that how many years does it take to become a highly skilled hair transplant technician?
As I told you, first level one starts with first few months as an
Hmm.
assistant technician. Now, some people, due to financial factor, due to far away distance, due to jobs, may not be do continuously. So even if you learn assistant technician, you can get a job in a clinic,
Mm.
and in that clinic they will further train you to become full technician.
Okay.
Okay, if you have more time, then you give more time to the academy, learn thoroughly. Over a period of 1 year, you will become, reach particular standards over a period of next 2 3 years. So you don't have to be in our academy for so much time. Of course, you're most welcome if you want to be, but we prepare you to get entry into hair transplant technicians, and in that clinic you can further learn. Or if you have time, you can spend for the fees, then you can be with us, learn for the whole time, and then go further.
Absolutely. And we already have trained many hair
Yeah, see,
transplant technicians
yes,
in our institute. Am
yeah.
I right,
You see,
doctor?
World Society of Hair Restoration Surgery is basically, we are into training of plastic surgeons and dermatologists.
Yes,
We have trained thousands of them across India, across the
absolutely.
world and India. So what we thought is, we are doctors are trained. They go and start the clinic, but every doctor calls me and asks, "Doc, I need some good technician to do it
Yes.
faster." Because even a doctor needs time, because he may learn everything, but that speed takes time, and he alone cannot do. As I told you, 5 6 people are required to do eye transplant surgery, because it's like one follicle implanted, one
Mm.
follicle implanted.
Yes.
So up till now we have been training hair transplant surgeons,
Yeah.
doctors, but of late we decided to give more focus also to train worldwide. So we also have affiliate centers across the world, like Australia, America, Canada, Dubai, Singapore, Malaysia, Indonesia, India, South Africa. So those who can come to Mumbai, great, the main center, the main faculty. Those who cannot come to Mumbai, no problem. We still have aligned centers all across the world. So this video is the one of the first videos which introducing, and we are focusing now also
Hmm.
into training and creating a lot of highly skilled hair transplant technician
Yes,
for our doctors who get trained with us in our
absolutely.
academy.
So, as we know, that hair transplant is a team surgery. So, a great team will always result in great results. Am I right?
Perfect team is required. Yeah.
Yes. Thank you, doctor, so
Thank you, Dr.
much.
Divya.
If you have any questions regarding the eligibility and the fees of the hair transplant technician course, do let us know in the WhatsApp number mentioned below, and we will let you know all the details about it. Thank you.
Goodbye.